Oh, hello, Lucia. It is so nice to see you. Thank you for joining us, and thank you for agreeing to come to CONy and to participate in our scientific program. You are a Parkinson expert, right?
Yes, Amos. Hi, thank you. Yes,
Yes.
it's a
Well,
pleasure to be here.
yeah, so I don't think you have ever been to CONy before. This will be your first, and I'm sure that you'll enjoy it. You know that in CONy we mainly have debates, pro-con debates, and we have about 15 or maybe even more debates on Parkinson's disease this year, but also on various other topics, on each neurological topic, on stroke and MS and epilepsy and dementia and so on and so on. But there will be 2 full days of Parkinson's disease debates, and in each of the debates there is a proponent and an opponent, and each has about 15 minutes to discuss their case and to convince the audience, and then we have time for questions and comments. This is the usual stuff that we do every year. This will be the 16th edition of CONy. Unfortunately, again, it will be virtual, but before I forget, I must remind you that next year we are going to be alive, and this will be, remember where?
Croatia, possibly?
Yes, in
Yeah.
Croatia, in the Adriatic coast, very beautiful place, and
Yeah.
it's called Dubrovnik. And you have not been there, you should come. This is very important, very nice place, and it will be nice to hug each other after so many years, a couple of years, 3 years that we have not been able to do it. This will be fun. So what do you like about the debates that we are going to have in CONy this year?
So I think the program this year is really interesting. It's been developed together by the section headers, Ray Chowdhury, Angelo Antonini, Stuart Isaacson, and the topics are focused both on the diagnostic process of Parkinson's. Some are focused more on the mechanisms, and others to the treatment, most of them. For example, we have a debate on COVID-19, if this could be considered a perfect storm for the emergence of Parkinsonism. And we will have
Right. So excellent. So this will be discussed by Ray Chowdhury, and who will be the opponent?
Angelo Antonini.
Antonini, very good, very good choice, and I'm sure it will be a very nice fight between the two of them. But you mentioned that we're going to discuss the diagnosis and pathogenesis and this and then the treatment, but it's not a series of lectures that teaches people to do. We are concentrating on issues that we are not agreeing upon, and there are different views to look at it. So it's an exercise, an educational exercise.
Sure, I agree with you. For example, we will have also debate on genetics. If genetics can be considered still already helpful to guide the care of patients with Parkinson's. So that would be very interesting to know and to learn about.
Yes. Okay, so we're going to, which debate will you participate personally in?
I will participate on a debate on the prognostic and diagnostic value of subjective cognitive decline with my colleague Elena Fiorenzato from Italy.
So is subjective cognitive decline a thing that heralds dementia in Parkinson's disease?
That's what we are going to debate about. In my
opinion,
you're going to
say?
I'm going to say yes.
Yes. All right. So we'll vote with you, for you. You know that the audience are voting before the presentations and also after the presentations. And it will be fun, not only education, but also fun. Thank you very much, Lucia.
Thank you, Amos. Thank you all. Thank you.